Hi, and welcome everyone. Happy Wednesday and post Valentine's. I hope you guys all had a wonderful Valentine's Day. My name is Dr. Farah Duro, and I'm going to be hosting a fertility Q&A live tonight, just in case you guys have any questions that you want the answers to if you're trying to conceive, whether it be naturally or undergoing a Medicaid cycle, an IUI, an IVF, or you just have questions in general. Perhaps you have already been going through an IVF cycle and you're a little bit confused about certain things, or you have friends going through that and struggling. We're here for you tonight, and I will be joined by Dr. Gelman from IVF-MD. So whenever he pops on, we'll go ahead and get started with our live tonight. And I see Dr. Nichols on. Hello, how are you? And we have another person here joining. So you guys are welcome to pop in your questions whenever you are ready to do that. We also have some pre-submitted questions as well, so we'll get to a few of those as always. And hopefully we'll give you a little bit more peace of mind with whatever route you're taking in your fertility journey tonight. So if those of you who don't know me, I actually am a licensed acupuncturist and Eastern reproductive medicine specialist. So I work with acupuncture, Chinese herbal medicine. We also do nutritional guidance. We look into ways to help maximize your success when you're starting to your journey with wherever that is. And I've started working with IVF patients in 2004. So it's been a while. When I was very in my 20s. So it's been a while. But I think over the years we've definitely seen strategies that have been really helpful. We implement those with our patients and try to also work with our patients during pregnancy as well. And we now work with menopause too, or some of our patients are in menopause, or they're bringing their teenagers in. We're working with them on all spectrums of hormonal issues. So definitely, let's see where Dr. Gelman is. I don't see him yet, so hopefully he'll pop in there. I see Shirley, so maybe Shirley can send, oh, he's texting me now, but I can't pop back into my text messages, so let me see if I can check it on my watch. Okay, now he's saying he doesn't see me. Let me see if I can invite Dr. Gelman in, and let's see if we can get started. I don't have any requests to join, but I'm gonna see if I can find. I see a request. Okay, we're good. We're getting here. And maybe
There it goes.
that will work. Awesome. Okay.
Always a
How are
little
you?
trouble, right?
Yeah, that's all right. I knew you were there somewhere. I was like,
How are you?
I know you're there. So
Happy
good.
Wednesday.
Happy
It's the
Wednesday.
first one for us this year, right?
Yay. Yeah, it is. Yeah, it's already halfway
It's
through
crazy, right?
February, which is crazy.
Huh?
I'm not sure. It's going by. Yeah, it is. And I was just trying to pull up a few questions that we had, but I also wanted to introduce you as well, if in case anyone doesn't know you, and kind of get an idea of what you
Well,
specialize in.
it's again, it's Dr. Kenneth Gelman, IVF-MD, one of, I don't know, is it 13 doctors now? They just keep adding. There's a lot.
A lot of you.
Again, I'm in Cooper City, and we specialize in everything. I mean, basically infertility, but all sorts of reproductive problems too, I guess. And anybody's having trouble with their periods or PCOS, that leading to fertility problems, things like that. Of course, we're going to see you. But IVF is the big focus there.
Yes, definitely. And we always have some questions about ways that everyone can maximize their IVF success, since it is such a very, emotional process as well, and it can be stressful. So so we definitely are going to share some tips tonight. Maybe you can share things that you've seen in your practice that have been helpful for someone just embarking, or maybe they're
Right.
restarting the
Right.
journey. So if we just had a question about that, so maybe we can jump off with that too. And just like there's someone said, can you recommend a diet and any tips before training?
Well, diet, I mean, it's I don't think a diet for 2 weeks or 6 weeks, whatever you're prepping, wherever you're prepping, before a transfer is something you should obviously you should do, but you should have been doing it all along. So it's not just
Mm-hmm.
a diet for the transfer; it's a diet for your overall health. Because when you talk about fertility, and people ask us about what to eat and things like that all the time. In the medical profession, any doctor you talk to is going to tell you to eat healthy and what the healthy things are. And of course, it's going to include a lot of fruits and vegetables and, antioxidant type foods and things like that. We talk a million times about Mediterranean diets and its effect and its benefits. But these are things that, should be
Mm-hmm.
lifelong in a sense, not just because you're trying to get pregnant, although trying to get pregnant is probably the biggest motivator people have. Even men get motivated when they come talk to us and we tell them, your diet isn't any good and you got to quit smoking, and whatever they're doing and drinking and things like that. And, they don't have to join the party every day or 3 times a week. You could really cut back and start
Yeah.
changing things because everything you do affects your sperm and your eggs, basically. So,
Yeah, that's definitely good to get that on board as well. As far as the fertility diet, we talked about that as well. Like some research from Greece that showed that the patients that were doing the like a Mediterranean-based kind of anti-inflammatory diet, they actually did better. And when I think this was the couples in their 30s, they did better and they had better pregnancy outcomes as well. When
right.
both partners were doing
It's
it,
true because, even we see it
So,
in our practice because, Marta and Dr. K, people like that, when they institute these things,
mhm.
and they go through a cycle, you see better egg quality. You know, I mean, it's
Yeah,
not every cycle, but a lot of times you see that a real improvement, and people are getting,
yeah.
cryo preserved blastocysts now with good quality PGT embryos. So, I would take
Hmm.
advantage of that. You know,
Oh, I can't hear you, Dr. Gelman. And I don't know if anyone else can hear you. Can you guys hear? I don't know. I think I lost the sound here. Hmm. Let me see. Okay. Is it back now? I
yeah.
think
Am
so.
I here?
Can you say something? Okay,
Am
good.
I here?
Yeah, okay. I lost you. Okay, now we're
Yeah.
back. I was like, oh, what happened? We lost the
No,
last few
I
sentences
guess,
there.
something was
Okay.
calling in, so I guess it lost the
Oh,
video. But anyway, can you hear me now? Can
okay.
anybody hear me out there? Okay, okay.
Yeah,
Somebody.
I can.
Okay.
Yeah.
So anyway, so it's all about the whole overall plan. It's not just here, take these
Mhm.
fertility drugs. We're going to stimulate your eggs. We're going to take your eggs out. We want success from the beginning. We don't really want to have people
Mhm.
going through that 2 and 3 times and making a major change in their diet plan and overhauling everything because their first cycle was terrible. And that's happened,
Mhm.
where you know it almost took going through the cycle to convince them that they've got to improve what they're doing. They've got to maybe keep their weight down.
Mhm.
They've got to eat right. We give them maybe 3 months or so to recruit new eggs and to expose them to good things,
Yeah.
including acupuncture, of course, and all
Mhm.
those things that we know are going to benefit them.
Mhm. Yeah, and sometimes they can take 3 to 6 months. It depends on the patient. I mean, we've seen that too. Like 6 months later, it's like, wow. I know you've seen that too. Like it looks like a different person. Like as far as the ovarian response or the
Right.
quality, sometimes it's very different from. I mean, from that moment. So we're asking, how long did you take those supplements, or how long did you do this? And sometimes, it can be. It's not instantaneous,
Right.
so we wish it were, but it definitely takes a little time. And So I think that was, I mean, yeah, that's probably what we recommend a lot is just basically looking at that and trying to give yourself some time to prep, you know, if you have it. And sometimes we just see patients like right before they start STEM and we just do the best we can. And we can definitely work with patients that are, you know, at any stage really. But I think it's great to have, to just give everything time to work and give the, do you recommend just like back-to-back cycles, or does it
Well, it
depends on the
depends on the
patient?
patient
You
and
know,
depends
like
on
if
the
somebody.
situation, depends on the
Hmm.
results and see what we have, you know. Obviously, if they do really well or
Hmm.
they, you know, they may or may not need a second cycle, you know, depends on the
Yeah.
age really and what we think we're going to get in terms of egg quality. Don't forget the major determinant of all this probably is age. You know,
Yeah.
and unfortunately, even if you're the healthiest person in the world, and if you're 42, you know, the chances of getting, you know, normal embryos is far reduced versus when you were 35. So, you know,
Hmm.
that's going to play a major role in all this. I mean, obviously, the healthier you are, the better you are. And presumably, any normal eggs you've got left aren't getting beat up by your diet, you know.
Hmm.
So that's
Yeah.
why it's still
Definitely.
important. But the major determinant could be your age.
For sure. And if you guys have any specific questions as far as, I know we talked a little bit about supplements and different things like that before with Q&As, but feel free to type in a question into the little question mark. You can do that, or you can type it into the comment section, and we'll be happy to get to that because I know that sometimes you
Yeah.
don't think of the
Yeah.
questions until it just like pops in your head at the very end of the live, and we're like, no, we don't have time. Oh no. So hopefully, you guys, we can get your questions in then. And I know you guys are great about, okay, yes, we do have a question about reducing toxin burden. Okay, as we were talking about oxidative stress and egg quality and sperm quality, there's a question about reducing toxin burden or endocrine disruption on any specific household or personal care products to eliminate and to avoid. Um, and I love the EWG. I think that website is great. The Environmental Working Group, because they actually update it. Like they have the Dirty Dozen on those the toxins that are very disruptive and things that actually foods that to avoid that. You know, you don't have to get everything organic. I think that doing that is look at you know the prices these days of
They
eggs.
said
Even you know everything
prices of
is
eggs
going
now are
up.
more
So
expensive than meat.
have like it's crazy.
Yeah.
Yeah, I mean, just those things. So I think, you know, you want to be very
Yeah.
concise
Yeah.
on
That's
what you want to
that's a big
get
problem,
organically
you
that
know,
makes
because you
sense.
may not want to be able to
Yeah.
afford the whole food stuff. You know, I'm sure their prices went up
Hmm.
too, and everything, and it's going to be
Everything.
tough
Yeah.
to really afford. But you know, things like
Hmm.
you know fresh vegetables and hopefully fruits that a lot of that, huh?
Strawberries are a big those strawberries. They're definitely a big one
Strawberries, yeah,
that you should always have
yeah,
organic
if they're
strawberries
good, you
if you're gonna
know.
choose. Yeah.
So, you know, all
Well, yeah,
that, I mean, I
that's
think, you
important. But
know, even
that
if you make a
website is.
fruit smoothie every day. But I mean, it's household stuff. I mean,
Mhm.
the big thing there is microwaving and plastic, you know, stop doing that and
Mhm.
get BPA free products and, you know, as much as you can, you know, because it's ubiquitous, that stuff. I think it's probably on your shampoo bottles. It's probably on your milk cartons, you know. Um, so you may want to transfer all those things into those kinds of containers.
Yeah.
You know, it's on your credit card. It's on your credit card
Well,
receipt
those
stuff.
plastic water bottles.
So you know,
Mm.
huh?
And water bottles.
Yeah,
I see the water
yeah.
bottles
The water
are a
bottles.
big one because
That's a
people
definite.
do
You know, so I wouldn't be
water.
drinking out of the Zephyr Hills bottles. You know, I transfer that.
Yeah,
Yeah,
little
yeah,
containers are nice, you know. They're usually pretty,
yeah.
and they keep your water cool, and you can know how much you drink. At the end of the day, it's like I should be getting 2 of these a day, but you know, it's not a good day when I've only gotten down by half when I get home. Like that's not good. I need more time. But you can measure your water intake. So you want to take in a lot of water to actually help your body detoxify and work with those things. And as far as the other tip, you know, I talked to, I guess it was one person who was very, you know, like knowledgeable with the environmental toxins. You said the most important thing you can do every day is take your shoes off when you walk in your door, because you're basically tracking in all these
Probably.
pesticides, all
Yeah.
these things from the outside. So yes, so always take your shoes off, and that's
Right.
like her number one thing
Well,
that she focuses on.
sleep is
So
a big thing too. So, I mean, I think it's very important to get sleep. And, you know, a
yes.
lot of people have sleep problems, you know, and, you know, melatonin is acceptable. I would take that if you need it. It can cause some bad dreams, though, so be careful with
Yeah.
it. Start off slow. Yeah, maybe 2
Little
milligrams,
tiny
you know, that
dose
kind
is
of thing, and
good.
see how that does, you know. But you may get some very intense
Yeah.
dreams with it. A lot of people complain of that. But sleep is very important.
And magnesium. Yeah. Yeah, that's, I mean, we focus really on your sleep and bowel
Yeah,
movements. Those are the main things we look at when someone walks in. So if we can get those
yeah.
going, then most people feel pretty good, you know. But yeah, I mean,
And
definitely,
for yeah,
it's
and I was going
important
to
for
say, if
guys
people
to
have trouble
get.
sleeping, you know, maybe the thing to do at night is to stretch, is to maybe get a good stretching tape, go online, get a good stretching video that you can do for 15 or 20 minutes. You know, holding the stretches to
Yeah.
really, it's sort of almost like a yin yoga class where you hold the stretches. I mean, to really stretch out your connective tissue, which is, you know, tightening up from the day, from all the stress you have. You know, that's what you want to get rid of.
Driving down the
So
palmetto.
maybe stretch for
Yeah,
15 or 20 minutes before you
exactly.
go to bed, and, you know, and read a book. You know, don't watch TV till, you know, because that may affect you.
Yes, for sure. So, and that's important. So I guess like when we look at also toxins, we look at what's going on in the work, you know, do you have exposure to chemicals? Like somebody was for instance, like an aircraft mechanic, working with chemicals all day, or working in areas that maybe, you know, have toxin exposure. We just have to be careful and measure those limits too, and to make sure that they're okay with their mercury levels, things like that too. If they're eating a lot of fish and, you know, those things. So guys, it's important for you too. I know it's hard. We don't want to freak anyone out and say like, yeah, you have to be in a bubble, you know.
Right.
But it's good to pay attention to those things. So a little bit. And I think there's a question about PGT. So if you could, does it tell you the
It
baby
does.
gender,
It does.
or
You
what
get the
is that?
gender, and it's, you know, 98, 99% accurate with that. So that's pretty good. But, you know, the main reason you do PGT, you know, unless some people are doing, you know, sex selection or gender selection, is to make sure that they don't have extra chromosomes, that the embryos are normal chromosomally as much as we can tell. So that when, you know, you're eventually implanting the embryo, you've got a good idea that, you know, you have a chromosomally normal embryo you implanted. And, you know, that gives you some reassurance about it's 95, and they say 98% accurate. So, which is pretty good, but there's still a 3% chance or 5% chance that you're not going to be correct with that embryo. So we would still recommend, you know, harmony testing or panorama testing at 12 weeks.
Yeah, that's true. And I think most of the
Yes.
OBGYN offices do
Yes.
those, right? They're those. Okay, good. And as far as the questions we had previously submitted, there was a question regarding FET implantation and prednisone. So how it's basically is the 5 to 10 milligram prednisone dose helpful for FET implantation, and when is the start to take it, and to when? So when do you start it?
Well,
If it's helpful, and then how
I
long
use
do you
it,
take
you
it?
know, not you know, on everybody. We use it in situations where we think it's going to be needed. So, you know, somebody who we think might have some autoimmune issues, particularly people maybe who have thyroid antibodies that are, you know, significantly elevated. Maybe they've had a miscarriage previously, and nobody's diagnosed their subclinical autoimmunity. So in those situations, you know, sometimes prednisone is given 5 or 10 milligrams. What I usually do is I give 5 milligrams twice a day with the transfer, and then I increase it if with a positive pregnancy test, and then taper it off at the end of the first trimester for something like that.
So low, pretty much like five
Well, yeah,
milligrams a day or
I mean, I'll
something.
taper it down and then I'll taper it off,
Mm-hmm.
but I don't
Mm-hmm.
typically go above 20 milligrams or so, because when you're starting to get up to higher doses, you
Mm-hmm.
potentially, especially later in the pregnancy, you don't want to continue because you're going to have complications. So the perinatal
Mm-hmm.
specialists are going to make sure you're off it. But there are people who have rheumatologic type diseases where prednisone needs to maybe be continued later into the pregnancy, but those people need to be monitored by specialists, perinatal specialists, as well as their OBGYNs and maybe even rheumatology.
I think the same person just had a question with the positive ANA
Yeah.
1 to 1280 ratio, and then but everything else was normally went to the rheumatologist and everything's fine. I think we've had this question come up sometimes, like a few times, where it's just kind of like a inconclusive sort of thing.
Well, yeah. I
Um,
mean, that person's got a positive ANA of unknown significance, presumably. Whether it's going to
mhm.
impact anything with the pregnancy or not, obviously, that's the concern. And but that's a fairly high ANA. I wouldn't consider that a sort of a false positive one, which is like 1 to 80-ish. So, I
Mhm.
mean, that person, I'd have to see what their history was, but most likely I would probably use prednisone on them when I transfer an embryo. What I just mentioned, 5 or 10
Oh,
milligrams. And then, I probably recheck their ANA once they're pregnant and see if it was reducing or not going up, you know, just to keep an
yeah,
eye on it. And, by the time they transfer out and they're seeing their OBGYN, I'd make sure that they have perinatal specialty watching them also to see what to do, how to manage that.
definitely. Yes. And there's a question about when an embryo is PGT-A tested and fine, can I skip
Well,
amniocentesis in pregnancy? Have you seen that lately? I haven't seen very many
well,
people
they'll
get
get
amnios,
it if the harmony test
but
or the panorama test is a problem.
uh,
Then they'll go on. They'll probably have it done by the perinatal specialist. Um, we've had maybe I don't know. I can count on my hand over the years. Not too many with
mhm.
PGT, but it does
Yeah.
happen. It does happen. I've had a case in the last few years. I remember
Hmm.
where it was a trisomy 18, and it wasn't detected in the PGT,
Okay.
but they picked it up on harmony testing and picked it up. So
Okay.
there are occasional cases where that's going to happen, but notably, you're not going to get amniocentesis with a PGT embryo unless you have a you know harmony test or one of those blood tests that are showing some abnormality there that's concerning.
Yeah. Yeah. It's just, I'm like, I'm thinking back and
Or an
I can't
ultrasound that's
remember.
concerning.
Yes.
Huh?
I guess it's more rare, but it definitely still is out there. So I guess it's whatever your OBGYN recommends, like if there's issues, because you guys are not uh, seeing anyone at that particular stage, I wouldn't think when they would do an amnio.
No,
So,
no, 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 we're not. So it's really the OBGYN that's dealing with that.
mhm.
But you got to keep it in mind that nothing's 100%.
Yeah.
That's the best technology we have, but yet it's not 100%.
And we do have a TSH question during pregnancy. So we know that that it's really important to test your TSH when you're pregnant. And there is a question here. I'm 4 weeks pregnant and my TSH increased to 8, but T4 is normal and I got under control. I wanted to know, is it very serious? Um, I guess a T4 is normal, but the TSH is 8, which is too high.
Well,
So,
yeah, I would treat that. I mean, if you're taking Synthroid, make sure you're taking it on an empty stomach,
mhm.
not with your iron vitamins or prenatal
Yeah,
vitamins. You could be absorbing the pill or any food really in your
yeah.
stomach. So that could be number one. And, you do have to keep that ideally under 2.5.
Mm-hmm.
So I would get that down, talk to your doctor and make sure you're on the proper dose and get it rechecked and make sure it's down.
Yeah, for sure, definitely. And I mean, that did happen to one of our patients actually last week, where it just somebody didn't know to not, take the Synthroid alone. So they came back with like a really wonky TSH, and their transfer was coming up, and it was at a different place. So it wasn't with you guys, but we were like, oh no, like, because she had to fly out of the city to actually have the transfer, and her TSH was really up. I'm like, what did you take it with? They're like, well, I took it with all my vitamins and with everything. And it's like, literally, it just negates it. So, once we're
Absolutely.
able to, kind of like take it, correctly, do you recommend 2 hours apart from everything, or just?
Well, ideally, and I know I've discussed this here before, but I think, the best time to take it is bedtime.
Okay.
Because unless you're a big eater at bedtime, which you
Mm-hmm.
shouldn't do, because that's a good way to gain weight.
Mm-hmm.
But if you stop eating, roughly 8 o'clock at night or something, and you go to bed at 10 or 11, you have nothing in your stomach for 3 hours, you just take it with a little water and
Mm-hmm.
go to sleep. And then it gets absorbed all night on an empty stomach.
Okay. Yeah,
Because 2 hours after food, your stomach is empty. That's a good time to take it.
Mm-hmm.
And then you don't have to worry about it in the morning, so you can just get up and eat and run, And then, because most people want to take it in the morning, and then they have to, kind of mess up their eating habits, maybe, because then you can't eat anything really until you maybe get to work.
Yeah, that's true.
So you got to be very diligent with it, I think, in order to absorb it. And the other thing is that with thyroid medication, the only reliably absorbed medication is Synthroid.
Mm-hmm.
Nothing else. I mean, I think levothyroxine, Levothyroid has been around. That may be okay. But some of these other generics I would not trust. So I would not get generic thyroid medication, only brand.
Mm-hmm. So Synthroid versus levothyroxine, or
Synthroid you can't go wrong with Synthroid.
Okay.
And
yeah.
If your insurance is squawking or giving you a hard time, I know the Synthroid rep, I think, came by a few times, and he's given us, I think, some special pharmacy to go to, or copay card. I can't remember what he did.
Mm-hmm.
I think it was no more than $25.
Okay. And I mean, you have to get this checked, like I would say, every month at least, your TSA. I mean, if it's elevated like that, you're going to check.
Well, that I get checked in, 3 or 4 weeks for sure. To make sure you're doing what we told you.
Yeah, for sure. That's important. And then we have a question about IV therapy during the cycle and surrounding IVF retrieval transfer. And what types of IV therapy do you recommend for poor egg quality? And it looks like they might be referring to the vitamin IV drip therapy. And though that usually we're not doing around retrieval transfer time or close to that, because things are being tracked very carefully as far as your blood work. You're on certain supplements that your doctor put you on a lot of times. So we don't really usually recommend doing, intravenous vitamin drip therapy close to an impending cycle when you've got everything sort of controlled very, very carefully. So that being said, there are some glutathione research that has come out that's been helpful for male issues too, and improving egg quality. And that glutathione, you can also take it orally as well. So there's definitely some good research on that. Usually it's kind of always starts out in mice, because that's just easier to check. But and then they actually start doing human trials. But I think that that's kind of the master antioxidant. It's naturally found in our body, and it declines with age. So that's something that is interesting. I don't know if you've been following all the cell research that's come out of Harvard about aging in the cell, but I think we talked a little bit about this on an earlier live. But I think they're finding out it's not really the cells or the genetics kind of just start to wane. It's more of the epigenetics and the cell signaling. So when your cells actually age, they start to signal less. So it's kind of like your power grid starts to go out a little bit more.
Well, there's a lot of theories that, one being that everything essentially, particularly eggs, but even diabetes, may be just really a mitochondrial disease and not really, I mean, I guess you get insulin resistance from it, but basically the reason people get the, poor egg quality really as you age is the mitochondria sort of die off, or, they're not as functional as they used to be to provide energy. So that's where things like, CoQ10, high dose, PQQ, all that comes into play. Glutathione being, an antioxidant to sort of prevent, free radicals and oxidation of your cells and things to keep them healthier longer, That's the same sort of, theories. So I think coenzyme Q10 is probably valuable. And, you got to take a big dose though, 400 to 600 milligrams a day.
That's definitely it. Yeah, and there are, I think, things that are coming out little by little. There's alpha lipoic acid. There's many things that are good for that. And so as we learn more about this, who knows how that will affect, fertility treatment or other types of cancer treatments, all kinds of things that they're thinking about using this cellular therapy with, or genetic treatment. But in the meantime, we look at what can be helpful to reduce oxidative stress, and that's what we breathe, that we're all getting, oxidative stress every day. But what can we help with? And I think vitamin C is one of the best things. You can take it daily. It definitely is very safe. It's water soluble, and it helps a lot with so many things. They've even seen sperm count increases with it and many things. So that's kind of a good part of your regimen. It's usually safe to do. Of course, like all the flu season and all these things going on, there are, there's definitely reasons to take it. But yeah, it can have the side effect is it could have it's also beneficial qualities for egg quality and sperm health. So those are my votes, I think. So, and let's see, I think we had a question pop up here. So let me put this here. Okay. It was about, I think it's Metnex is the question here. I was asked to take Metnex for folic acid. I did my retrieval. Should continue to take until transfer, or when should I stop taking it?
You could stay on it. I mean, stay on it until your transfer. I don't see any reason why you have to stop it at this point. But the thing is, once you get transferred, the question is, do you have do you have two genes that are abnormal or one? Because if you have one gene that's abnormal for that MTHFR, chances of really having a problem are probably low. So you may or may not need to necessarily continue it, although you should talk to your doctor about that, whether they want you to take it, once you're transferred, or if you have a high homocysteine, they may want you to stay on it.
Okay, yeah.
So there's various reasons to stay on that.
That's for sure. And yeah, high homocysteine is not good for your body, not good for anything in your body. So that's important.
No. So make sure you know what you're taking it for.
Yeah, very cool. Very good. And we have a question about endometritis, that nasty persistent endometritis that is always really frustrating. Is it possible hysteroscopy doesn't clear it?
Well, I hope it does. I mean, that's why you're doing it, presumably, because maybe the antibiotics haven't been clearing it up. That is a problem for some people where it just doesn't go away. And I found that, there's some variation between labs in terms of how much endometritis one person has, depending on the lab that the specimen gets sent to. That's number one. Number two is everybody that I've treated so far with, either 2 weeks of doxycycline, and I've done a follow-up biopsy, which I've now been doing the Emma and the Alice biopsies from Ingenomics, which is this new biopsy that's more like almost like a culture of the endometrium. It tells you, the good and the bad bacteria, and it gives you maybe a little more specification of what could be causing some of this. Almost everybody was clean.
Okay.
So, and then I look back at all these people that we presumably were treating again because the regular biopsy that we send to their insurance, not the M&Ls, a lot of people would come back still with, chronic endometritis still there or, suspicious for kind of thing. And we never really knew what we're treating there because but now we have this M-analysis test, which a lot of times is not covered by the insurance. So we have to tell the patient that.
Okay.
And it has to be done at a special time of the cycle, but I've been doing that second after the screening biopsy, the first one, to see if they even have it. Obviously, if they don't have it, they don't need M-analysis, but if they have it, I give them the antibiotics and at some point maybe do that M-analysis biopsy as a second one.
Okay.
And it gives you a little bit more information in terms of whether something's really there or not. But everybody's been clean, so
Oh, interesting.
I don't know. I just don't know if the pathologists at certain labs are just a little more, more discriminatory than others.
Oh, and is this covered by insurance also?
The M-analysis is not. I
Okay.
don't think. That's like a special test. But the regular biopsies go through insurance.
Right.
But the regular biopsies don't give you any information. It just tells you, do you have plasma cells present there or not? Because they do a special stain. And plasma cells are involved with inflammation, such as endometritis. Now, the hysteroscopy, is a good thing, where it's done because, let's say you have some kind of piece of tissue in there causing it that a biopsy may not pick up, but the hysteroscopy, you'll see it and you'll clean it up like a little retained piece of tissue, or you had a D&C and you got a little scar tissue there or something. So it's not a bad thing. So hopefully your doctor will find it.
Yeah. Okay, that's good to know that there's another test that I can pick.
Yeah.
This is very frustrating. I keep getting those biopsies and then
No, I don't want to keep biopsying people. It's a horrible test.
It's not fun.
It's like torture.
Yeah. Oh.
I had to do like 6 of them on Valentine's Day.
Oh, nice.
So it was like, I sat there, I said, Jesus, I'm so sorry I have to give you this Valentine's Day gift.
That's fun. Oh,
Yeah.
well, yeah, if you can spare that, that would be.
No, I'm telling you, that was tough.
Yeah. Well, I think there's, and also a fear, like, am I making sure everything's good before the transfer? And if that's like a lingering doubt where it's kind of like low plasma cells or who knows, that sort of thing, it's very disconcerting.
Well, that's the point, is that, you don't want to have, that's just exactly the right words, lingering doubt. You don't want to have lingering doubt, or the patients, are pretty smart these days. They know exactly what could be affecting what, and you don't want to necessarily be the doctor to say, don't worry about it, and then they go through a transfer and it doesn't work. I mean, I don't think that's great.
Yeah.
I think you want to eliminate that lingering doubt as much as you can, so you try to unturn all the stones and get rid of all the potential issues such as that endometritis.
Yeah, that's helpful too. And then repeated antibiotics for months and months is not pleasant either.
Exactly. Who needs that? You're setting yourself up for potentially a super infection or, pseudomembranous colitis or anything like that. That's not good.
Yeah.
So we got to, try to curtail that.
And there's a question about alcohol. Does it affect semen quality in the IVF cycle lead up? I think Marta just posted something about this, about the effects of alcohol with male fertility. So what is your take on it?
I think, heavier drinkers, it presumably is not, beats up the DNA. It sort of, whacks around the sperm. And, I remember looking at some sperm specimens after they'd been appropriately stained in people who were heavy smokers and drinkers. You can see the sperm heads are completely disrupted. So if you do the test called the sperm chromatin structure assay, that tells that they've got fragmentation of the sperm, and it may be high for some toxin, presumably alcohol. So, those are the kinds of things I would curtail as much as possible.
Yeah, definitely it's not going to benefit them. So that's for sure. If they're doing if you're trying to do an IVF cycle, we try to limit, or really just discontinue smoking, drinking.
Well, yeah, I mean, it makes sense. I mean, most people need, the IVF is not covered. This is an expensive proposition.
Yeah.
And, many people, have to take loans or whatever it might be. And, might not make it work.
Yeah.
And, they have to think about how this is going to affect their outcome.
We have a question about intralipid infusions for elevated natural killer cells. This question is that if your doctor doesn't believe in it, are there any natural remedies you can do?
Yeah. Well, the old story about eating McDonald's French fries, I guess. I mean, that story's been out there for years, where people have gone and ate a large McDonald's French fry before their transfer.
Wait, for the natural killer cells?
Well, it's soybean oil. The soybean oil, because the main component of intralipids is soybean.
Interesting. So that's the French fry thing. I've been trying to understand what is the French fry, McDonald's French fry have to do with it. Okay.
Yeah, well, there you go. So but nobody's proven it, and nobody's, but that's circulating around a lot of internet sites and stuff. So, I mean, if your doctor doesn't believe in it, look it up. Maybe you should go eat some McDonald's French fries.
Okay.
It's the only time we're going to promote McDonald's here.
Okay.
We're never going to promote McDonald's other than their French fries.
Yeah. No. Well, I mean, are you saying right before a transfer, or?
Yeah, an hour before.
Oh, yeah, interesting. And I mean, there is something about NAC, N-acetylcysteine, some research about that, and that also helping with elevated natural killer cells. They actually did a research study in Japan on pregnant women who had recurrent pregnancy loss, and they actually took NAC during the first trimester. It's like one of the few studies I've actually seen for supplements during pregnancy, because you never see that. So
I haven't seen that.
Yeah, it was a while ago, but they showed lower miscarriage rates, and I thought that was interesting. And it's who knows, a precursor to glutathione, but it works in so many different ways and so many actions. They tried to actually make it a prescription drug actually during COVID, and that was it was hard to find NAC for a while, but that's something that was interesting, and that study came out. But I think if someone's not doing intralipid infusions and they are trying naturally and they have had a history of recurrent pregnancy loss, then NAC is another option that perhaps could be helpful, and it's safe generally. But we usually would also recommend if someone is pregnant naturally and they do have an elevated natural killer cells history, we tell them to go to you guys to start the intralipid infusions right away. The minute they get the pregnancy test, it's positive, because sometimes you need to do things very quickly, and it might be that that infusion needs to be done right away during that time, and hopefully it's going to be enough time. We've had patients where that definitely helped. I think you can see the differences when they did it and they didn't do it. So and also with IVF too, with clinics they went to where they didn't do it and then they actually went. It's not 100% though, like anything, right? So
it's not. I mean, I don't know why a lot of clinics are against it. I mean, there's absolutely no side effects from it. It's nothing,
Yeah.
I mean, I don't understand, what their concern really is. I mean, I guess they think the data is not really there.
And I mean, the things are not everything has maybe like a ton of data, but you have clinical, validations that it does help in some situations.
Definitely. Like IVIG definitely works.
Definitely. And let's see. So yeah, that would be something. I mean, also, if you've had a lot of losses, I would get a second opinion as well. I mean, I don't know, like if you're going through, because we did have a case where it was really heartbreaking, where this patient had 4 normal PGT embryos transferred,
4 miscarriages. It was literally like 1, 2, 3, 4 in a row. There was no like pause or anything. And so she had 7 total embryos. So we actually said, let's just, she was going not to you guys, somewhere else. So I said, can you please get a second opinion before you do this next transfer? Turns out her natural killer cells were through the roof, and her blood clotting factors and APA, all of that was positive. So she had the double whammy of like the blood clotting issues and high natural killer cells. So she did get those treated before the transfer, and she was able to have a healthy baby. But she was just burning through her embryos without giving anything a thought. And it's like, I mean, obviously she's just pleading with her doctor, like, can I just get tested for this? And they're like, well, we don't believe in that natural killer cell testing. Just, it's going to work. It's just bad luck. And when you say bad luck to someone who has like perfect embryos, it's just heartbreaking.
You're losing the battle there.
Yeah. So I'm glad that she was able to have a healthy pregnancy. She was, needing a blood thinning medication. She did interlipids. So that's one thing. It just breaks your heart to see, somebody that's
well, that's why we tend to do all that testing before even the first one, a lot of times. Yeah. Just to make sure nothing is obvious there. Or if we think they have endometriosis, we should be clued in that that's maybe why they didn't get pregnant in the first place.
Yeah.
And, they never had surgery. We never proved it or anything like that. And they did IVF. And, before their even first transfer, you may want to, look at that and, maybe give them intralipids for that reason.
Yeah, I read Dr. Beer's book many years ago, Is Your Body Baby Friendly? It was, one of the first time I ever heard about this condition with autoimmune infertility. And he was saying in there, like, there's one symptom where a lot of patients just don't tend to get sick. Like, they have extremely good immune systems. And so that's one of the clues where maybe you should get those those natural killer cells tested to see if that's an issue where you're basically, immunizing against the pregnancy in a way. So I don't know, it's interesting. But yeah, I mean, we've seen it. We've kind of asked them, yes, and then we come and they're like, oh, yeah, high natural killer cells. It's great during COVID and everything, but when you're trying to do IVF, it's difficult. So yeah.
Well, the problem, also the problem, I mean, I guess the pro and con argument against it is that you don't know what those killer cells are elevated. It doesn't necessarily why they're elevated. I mean, maybe you're exposed to something like a virus that has nothing to do with pregnancy or implantation.
Yeah.
So that's why maybe some doctors don't believe in it because, you can't specifically tell which population of natural killer cells are involved in a potential loss. It's just a generic measurement.
But you also test them during the biopsy too, though. I think we talked about this. Right?
Well, there's an immune test that, again, is not major. A lot of doctors don't necessarily do it. Immune protocol, endometrial immune protocol, or EIP we call it, and it tests whether there's chemicals involved with inflammation inside the uterine lining indicative of natural killer cell activation.
So that and that you see it pretty consistently. I wonder if it matches someone who has blood tests showing that they're.
It may not. It may not, and that's why we do it, or we're doing it, because you can see it locally and not necessarily in the blood. And those people would maybe still be candidates for intralipids, whereas you may not have considered it.
Okay.
If you just did the blood test. So, that might be a test that somebody would do, before a transfer or has had implantation failure, where nothing's really been detected, and then they do this test. We find that they've got some elevated cytokines, as we call them.
Okay.
That's another blood test that I do a lot of cytokines blood tests, but you also do it with this biopsy. And you get an idea of whether products of inflammation are being excreted there, and maybe from there you can tell whether they have some autoimmunity, subclinical autoimmunity that nobody's detecting.
Okay, well, so yeah, it's worthwhile to look into this testing. I think sometimes, especially if there's been. Yeah. Do you say, okay, we'll do it after 2 miscarriages, or like just kind of if there's endometriosis, maybe that could be
Yeah,
a reason.
definitely.
Mhm.
Endometriosis is usually a clue that there's autoimmunity there because it's an autoimmunity.
Right.
Um, you know, but the question is when do you do it?
Hmm.
I mean, people have gone through IVF. They have embryos, beautiful embryos. They got one or two. They had one transfer and they got one embryo left. And they're not going to do another retrieval, or something like that.
Hmm.
We have to be a detective.
Yeah. Yeah.
You're going to have to do tests and things, and unless you're just going to go for it like other doctors would do.
Mhm. Yeah, that's worthwhile. It can take a little time, maybe a month or two, to kind of get everything, little results back. But I mean, you put so much investment, time,
Well,
energy, money into the cycle. It's important.
yeah, you would probably would do that, but again, the pros and the cons of this. While there may be some abnormalities, how do you know definitively that that's really the cause of your problem?
Hmm.
Or if they've had elevated natural killer cells that suppressed with intralipids or IVIG, is that
Yeah.
definitively the cause of your implantation failure or your recurrent pregnancy loss? You
Hmm.
would think so. I mean,
Yeah.
there's been enough cases where they've gotten treatment and, like your case,
Hmm.
and they've been pregnant now, but definitively, did that patient, after all those embryos failed, was it the immune treatment?
Yeah.
Presumably.
Hmm. Yeah, so it's important to get that looked into. And not every clinic does those tests, so and that's the problem as well. It's not like a universal protocol. So I guess those are the questions you need to ask, for sure.
Yeah, no,
Um,
I mean, most people are pretty smart these days. They'll come looking for another opinion because of those issues,
mhm.
you
Yeah.
know, because their other clinics don't necessarily get involved. And,
Mhm.
we see many cases of people with implantation failure. Classic,
Mhm.
beautiful embryos.
Yeah, that's heartbreaking. I know. It's
It
just,
is.
yeah.
It is.
We have a question about acupuncture treatments, and we talk about this quite a bit. What do you tell your patients? And I'll give my take, but I know, like, as far as if someone asks you about when to start acupuncture when you're undergoing a transfer and that sort of thing.
Well, at least 6 weeks, at least, preferably longer
Yeah.
beforehand. So, if they can get 2 or 3 months before, that would be great.
Yeah.
Uh,
And I think that's the part of, not wanting to wait till the last minute, but also giving your body time to benefit from the treatment. I think it's important as well.
exactly. That's why we're telling them to do that.
Hmm.
And then they all come in and they say, "Oh my God, I feel so much better.
Yeah.
I
Yeah.
fall asleep on Dr. Duro's table all the time."
I did have a problem where I couldn't wake a patient up the other day. But she was 10 years old too, She was a patient of her mom. I treated her with fertility issues. So anyway,
Right.
yeah, so she was completely passed out. I was like, wait a minute, it's time to go home. She didn't want to get off the table. But not a bad problem, It's like I wish
No.
we could all relax like that. But but yeah, I mean, if you're in that fight or flight mode, I think it's always better to try to get that little switch flipped as much as you can. And we talked about doing like yin yoga, like you talked about, and trying to get some outlets for your stress and anxiety. It's just rampant. So and then working on blood flow. Of course, circulation is a huge issue, and we really try to hone in on that with either acupuncture, massage, or both, or supplements as well, fish oil, things like that, because the more blood flow, the better during, this type of treatment. Your, ovaries need to actually respond to those medications and get the nutrients and get the medications in and all that. So good blood flow is important during pregnancy and also for fertility.
Right.
Um, and that's what we try to focus on the most. But I think the more issues you have, the more things that are going on with you, the earlier you need to come in. Maybe a couple months prior to is not a bad idea. And some people are in the middle of doing testing. They're doing genetic testing. They're waiting for their transfer for a while. So it's going to take a little time anyway. And it's a good time to just nurture yourself and try to get yourself as healthy as possible through nutrition, through, self-care. Maybe certain things have to be put on the back burner, and that's hard to say no, but saying no to certain things And
Right. I mean, a lot of people, unfortunately, they have to wait a little bit in our practice, to get transferred these days. It's been busy, and they're getting put on a schedule a little bit later than we'd like, some of them, but it's not so terrible. It's just like you said, because it gives them time to do these things,
yeah,
to prepare, to get really relaxed and comfortable and healthier, and get ready for it.
yeah.
So it actually is not a waste of time, and they're very anxious and they get mad because they're getting put on a schedule in April,
Mhm.
Whereas they could spend this next month, instead of complaining, potentially doing things that are going to benefit the result.
Definitely. And even just honing in on like, let's get the vitamin D optimized. Let's do things like that we can do proactively, and when you're ready, you're going to, definitely, hopefully feel better. You're going to be less anxious and going into it.
And your everyday life will benefit.
Mhm.
Not so
Yeah.
bad,
Yeah, exactly. Yeah.
Maybe your coworkers will like you better.
Well, we get that a lot from spouses, like just go to your acupuncture,
You know,
It's, I mean,
it's all because you're acupuncturist. That's why your coworkers like you so much.
there we go. Yeah. Yeah. Well, we've had actually people give their bosses gift certificates for
Oh, is that
acupuncture.
right? Oh,
Like,
yeah.
like, hey,
They're like, the boss says to them, well, what have you been doing? Why'd you give me that?
Yeah. There we go. Go on your lunch out. It's good. But yeah, I mean, that's something. And then, we try to work with patients during transfer time. If we can go there during the transfer, that's helpful. Just doing that protocol pre and post, and then afterwards as well. So, but during that time, definitely nurturing yourself and your partner too. Like we treat them as well sometimes. So, I think we made it through our questions, I'm pretty sure. And we have maybe one more question about something that's come up a few times, but I think maybe we've covered this, but about, do IVF babies have a higher risk of congenital heart problems versus naturally conceived? What does that mean?
Well, there may be slightly higher risk, particularly of cardiac and maybe urogenital abnormalities, particularly in ICSI conceived children. But, it's slightly above where normal birth defects lie. It's not astronomically elevated. But the abnormalities that seem to have occurred were surgically correctable. So, but these things do occur spontaneously too.
Mm-hmm.
But, there may be a slightly higher risk according to the studies I've seen on that.
Mm-hmm.
But I've not seen anything like that in years.
Mm-hmm.
Maybe one or two over the years. That's about it. Not much.
It's rare.
Yeah.
Definitely. So
It's not common.
yeah. And there's, I think we'll squeeze in one last question about how do you diagnose endometriosis, and do you have to do an exam? Which one?
Well, you could make a presumptive diagnosis a lot of times, but to really make the diagnosis, you have to have surgery and surgically proven lesions, which usually are seen at the time of the surgery, and that they should be removed, not just cauterized, for adequate treatment of that. But that's really the way you would diagnose it. But sometimes you can see it on ultrasound, particularly if the patient has endometriomas in the ovary. Those have a very distinctive appearance to them. So you can make a diagnosis that way. And, patient's history is usually pretty classic, but that's the only real way to make a diagnosis for sure would be surgery.
There's an interesting one from France now. Have you heard of the Zewig? It's called. I don't know how you pronounce it, but apparently it's a saliva test to diagnose endometriosis that it was proven actually very effective. So I guess they had 200 patients, and it was very accurate. So it was interesting. I don't think it's approved here yet, but I thought, well, it'd be great to have that,
Blood test. They're working on a blood test for that.
Yeah. That's interesting. Yeah. So I'm not sure why they chose this just simple saliva test, but it would be great. I know a lot of people don't want laparoscopies, and it's just,
Of course.
surgery. Yeah.
Of course. That's not the trend anymore. People aren't getting a lot of laparoscopies for diagnosis anymore.
Yeah.
even if we think they have it, unless it's very severe, you know, people are just getting IVF.
Yeah. Yeah, very good. So that brings us to the end of our questions, I think. And I really appreciate you guys chiming in. And I think that's it's always good to share, you know, these questions, because
Well, that's
most
great.
of the time people actually have the same questions and maybe they're just, you know, not asking them. So you're helping out other people by asking these. And I think, you know, also we do post some interesting research from time to time and some tips also on our Instagram. So if you haven't followed us, please do that on FL Complete Wellness, and then also on Broward Fertility Expert, right? For yours.
Yeah, yeah,
Mhm.
anytime.
Yeah.
Anybody wants consultations or virtual consultations,
Mhm.
give us a
Yeah.
call,
Yeah.
you know, and we'll try to talk about some recent articles maybe
Mhm.
when we get a chance. There's not too many questions.
Yeah. Awesome. Well, thank you, Dr. Gelman, and
My pleasure.
thank you for coming in. And then everyone else, have a great night and a great
Good
week.
night, everybody.
We'll see
Have a great
you
week.
soon. Bye,
Bye-bye.
everyone.